Hi everybody, my name is Lenehan and I'm from the Department of Occupational Medicine here in the Mater Hospital. The role of occupational health in accordance with the National Isolation Unit Plan is to ensure that appropriate occupational health advice is available for all staff as required. We shall obviously oversee the health surveillance of staff as needed. We will liaise with the clinical nurse manager from the National Isolation Unit and any area that has been affected by the intake of the current case. Our operational responsibilities, we will be responsible for the coordination of health surveillance and for all staff contact with the current case, and we'll offer relevant prophylaxis and vaccination to these staff when they become available following discussion with infection control consultants. Current practices, should we receive notification, we will receive notification from the switchboard when a confirmed case has been admitted to the matter. We will then liaise with clinical and nurse managers of the relevant areas to ensure that a log has been compiled of any contact who's had exposure to the confirmed case. Once received, we will review the completed log of the healthcare workers in contact with the patient. We will then generate a unique confidential code for all healthcare workers requiring surveillance to maintain confidentiality for the healthcare workers. We will then ensure high stable surveillance of staff for 21 days after the last exposure to that confirmed case. Obviously, as to your work, I appreciate the National Isolation Unit is restricted access. Access is restricted to healthcare workers who have undergone the necessary training, healthcare workers who are not pregnant, and healthcare workers who are not immunocompromised. This is the log that we have reviewed, and this is the log that we're hoping to use should any confirmed case occur. On it, obviously, we need we need the date, we need the name of the staff member who's had exposure, their title. We need a current email address and phone number so we can make contact with employees as soon as possible. We need a department they're from, time in and time out of the National Isolation Unit or the area that's been affected, and also whether or not the person listed has actually provided direct care to the source patient or not. This form is readily available from the department should it be required. On receipt of the completed form, our consultant in occupational medicine will review the log from the relevant areas. We will then health workers who are listed in the log who do not have direct exposure, so they're listed as being a non-direct contact, confirmed case will be contacted and reassured accordingly. Passive monitoring will be advised for those staff members. We'll ask them to self-monitor for 21 days after the last contact with a confirmed case. In this case, they're deemed to be a low risk, so there's no travel restrictions required, and they will not be required to submit the 21-day surveillance as required for close contact exposures. Healthcare workers who were listed on the log as having had direct contact to the confirmed case will be included for active monitoring. Each healthcare worker listed as requiring active monitoring will be given a letter. On this letter, we will generate a unique coded confidential number as issued by ourselves and logged only in our department. They'll be given a thermometer and a copy of the Ebola virus disease monitoring protocol as available. The Department of Occupational Health will send an online survey request twice a day to every healthcare worker for them to complete and submit with required information of the temperature, the symptom checklist is checked, and for 21 days after the last contact. So we will continue it on for the 21 days after the last exposure to the contact. Should a healthcare worker be unhappy with dealing with an online form, there is obviously a paper format required. We're hoping to do as real time as possible and to encourage close monitoring as possible. Real time we can. We have a cunning plan. We have developed an online survey, and on that survey, this is what our healthcare workers will see. It's just a reminder of the protocol that is available. As I say, they will receive a hard copy with a thermometer and information pack. Just an opportunity to remind staff again, if they were to have a temperature anything above 37.5, to notify the health department. If they were anyway symptomatic, please do not take antipyretics. Please contact the Department of Occupational Medicine, and we will assess and review accordingly. On it, we also have a compliance statement. We are conscious our healthcare workers it is difficult for them 21 days later to still complete this, but we are obviously keen that we complete closure on it and we can reassure them after 21 days, if very symptomatic, that they are indeed clear of having risk. So compliance statement at the bottom, just to ensure that they're happy to complete it on a daily basis, and we will be attending to them twice a day. As I say, it's an online assessment tool, which is fairly okay because they can complete it fairly quickly in 4 minutes, I suppose, at work or at home. Because after exposure, there's no need for work restrictions. They continue on working, or if they're at home on the weekend, it will take 2 minutes of their time, twice a day to complete. We've made it as easy as possible, we hope. As I say, we will have generated a unique confidential code for every staff member. We ask them to input it here at identification. To record the last time and date of their exposure to the contact, and at the time of surveillance, what the temperature is, and if they've experienced any of the following symptoms. If they've taken yes to any of those, we'll ask them to complete the onset and duration that they've experienced. This is the last page they will see when they click on. All healthcare workers are providing direct care patient care, including the lab personnel and anyone managing the waste stream, are required to complete this form twice a day. We are hoping that they will do so within the hours of 8 a.m. and 8 a.m. and 9 a.m. and again, as I say, twice a day at 8 p.m. to 9 p.m. In that way, we can have a proper capture of people's well-being and actually contact any staff member who perhaps haven't submitted their form yet, and perhaps give them a phone call to see if they're doing okay. Again, it's an opportunity for us to remind the staff member to look out for pyrexia or any symptoms and contact occupational health should they have any concerns. That's the form we'll ask them to complete twice a day. It's really straightforward. Again, it's available online as well and we can make it accessible as quickly as we can, and it's convenient for staff to complete. These are the results we received. So once it's been submitted and submitted and pressed on by the staff member, this is the report we will get. Again, it's completely confidential code limit. Logged only with Department Records, so it's not available to anybody else. So it's a coded sample or a coded record, and again it just gives us a brief overview that they're asymptomatic, and in this case they're pyrexia, and we're happy enough to record that and we'll continue to do so. If it came back, it's obviously showing they have a temperature that needs concern, our occupational health physician is monitoring the reg. We go in accordance with the ECDC guidelines, and we've pretty much discussed the first two, passive monitoring and active monitoring as required for healthcare workers. However, in the case of an unprotected or inappropriately protected contact or a known breach of protection has occurred, healthcare worker will be incensed, and in this case we involve infection control disease consultants with us, and we will discuss whether or not the risk assessment of what next measures need to be required. Obviously, they'll continue to have active monitoring for both cases. In the case of needle stick as well, we will continue with active monitoring and again with consultation with consultants infectious disease. Effective surveillance should be, in accordance with ECDC, proportionate to risk and ensuring best possible management. Measures for healthcare workers should be proportionate to the risks and ensure the best possible management in case of an ill, while aiming at protecting them, their families and public health, as well as respecting personal rights of the healthcare workers. Thank you so much.